some of the major developments we're following on this Monday. More than 11.4 million cases of coronavirus that we know of around the world. At least 534,000 deaths as more than 6.1 million recover. With me here to start us off, as usual, ABC Chief Medical Correspondent Dr. Jen Ashton. And Jen, Friday you spoke to the director of the CDC, Dr. Robert Redfield. What did you learn?
It was an incredible conversation, Amy, because what it really crystallized is that we are still learning every single day about this virus, and as such, things will be revised, and these revisions will get headlines. So I want people to be prepared and do a deep dive on a couple of the things that I learned from the CDC director on Friday, because I do expect them to get more attention. Number one, is this virus mutating? We are seeing evidence of that. We expect that with viruses. This is what viruses do for a living. They mutate. It is important to remember, as we discussed here before, not every mutation makes the virus worse or more dangerous. Some are neutral, some actually make it less dangerous. However, there is new data out that suggests that a mutation that the SARS-CoV-2 virus has experienced has made it slightly more infectious. But I want to qualify, this new strain does not appear more deadly. So people are going to hear this headline, it's mutated, understand that we expect that, and it doesn't necessarily mean it's more deadly.
Yeah, that's important to remember. You also spoke to Dr. Redfield about how this virus has disproportionately affected members of the Black community, the brown community.
Yep.
What did he have to say about that?
Well, this is really an important issue, Amy, and we've seen this from the beginning. And so I really kind of hit that hard with Dr. Redfield, mentioning that the CDC right now is only tracking about 45% of COVID-19 cases by race and ethnicity. Partially, that responsibility falls on the local health departments because they have to report it. So the CDC has made this a top priority, adding a data field to all testing requirements and forms so that they can get a better handle on this, because we know that this is a group at much higher risk. And in order to prevent it and deal with it appropriately, you have to get an idea of what kind of numbers we're talking about.
And I know you also spoke to Dr. Redfield about testing, and you learned that there are some changes.
Exactly. And you and I have talked about this, Amy, that there really, we have been behind in some ways, not just logistically, but also in terms of the testing philosophy and strategy. So I asked Dr. Redfield about that. And what is new there is that in the past, only people with symptoms or at high risk for having COVID-19 were really recommended for testing. Now, Dr. Redfield has told me that anyone who thinks that he or she may be infected should get tested, even those without symptoms. So testing asymptomatic people, very, very important. But ultimately, the testing strategy is being left up to the states to figure out. And so we're going to see some changes there. But that is big news. If you feel you've been exposed or you're infected, you can get tested now. Yep.
All right. Dr. Jen, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.